I am Dr. Rajeev Agarwal, Senior Director Breast Services, Medanta the Medicity Hospital, Gurugram. As we know that when we operate breast cancer patients, either we remove the whole breast, what we call as mastectomy, or we remove a part of the breast, what we call as breast conservation surgery. Since breast is a sign of femininity, most of the patients of breast cancer, they have a severe anxiety about removal of the breast or size and shape of the breast that will change after the breast cancer surgery. This causes lot of stress and loss of self-esteem. To talk about this, I have with me Mrs. Srikala Nayyar, who is our senior counselor at the Medical Oncology Department of Medanta the Medicity Hospital. I will request Madam to talk about this loss of self-esteem in the breast cancer patients and how we can overcome them. Madam, please.
Thank you so much, sir. Like you mentioned, sir, it's a very traumatic time for any patient who undergoes mastectomy, and every person reacts differently on stressful situations. It all depends upon from which background they have come from, what upbringing they have been through. So it all attributes to this, cope-up mechanism. So therefore, in my experience, what I have seen is like during the diagnosis, before the treatment starts, those are the most traumatic time for a patient, and those time care and from the loved ones, the immediate family and the psychologist, and most importantly the spouse is very, very important at that point of time. So one have to tell them, like, it is not just an organ which contributes you, it's you, your inner beauty. That's the most important thing for us. So that has to be, that affirmation is to be needed every now and then, which needs to be communicated to the patient at regular intervals. She may get offended sometimes, she may get upset, she may get angry. Those are all very natural progression, but then one has to deal with it with lots of compassion and patience. There are other side effects also along with this, so that also act as a major breakdown point for the patient, like losing of the hair. The breast is already gone and then the hair is going, and you have become very thin, your complexion is gone dark. All these things become very, very traumatic for the patient, and so it's not just one thing which they are dealing with, it's multiple things which they are dealing with. So like I said earlier, breasts are a sign of femininity, and losing that becomes the most difficult one for them to absorb. I've always noticed a thing in the patients, like like I said, different stages in the treatment. Soon after the first phase of the treatment, once they started realizing that, okay, like breast cancer is happening in every 3 minutes as per the new statistics. So every other person is dealing with this. So I'm also one among them. That becomes one point for them to cope up with the stress, and then they slowly start realizing that it's okay, like I can manage with like this also. There are more of me, or I can do many more things in life. This is just a very small, very minor part of me which doesn't have much significance, which I thought yes it had, but then actually speaking it doesn't have. It's not just a breast which define me, it's more about many other qualities which defines me. So gradually when this sinks into the patient's mind, she also start accepting the fact and then moving forward to a positive direction.
Thank you, madam. Another thing which I will like to mention, that since now the technology is available, when we remove the whole breast, to maintain the shape and size, we can do a breast reconstruction also, which gives definitely a better physical appearance and psychological relief to the patient. Even in partial breast removal, if we think that shape and size is going to slightly change, we can do a reconstruction of the breast, or we can do what we call as oncoplastic surgery of the breast, where shape and size can be maintained. I think with these measures and what Madam suggested, the psychological interventions, a lot of self-esteem can be improved in the psychological mind of the patient. Thank you very much. Thank you, Madam.
Thank you, sir.